Hello everyone. Welcome back to Module 4, Part 3 of the Digital Health Foundation course for nursing. In this part of the module, we will explore how electronic medical records or EMR and enterprise resource planning ERP systems are transforming the healthcare delivery system in today's world. I am Brigadier Dr. S. Geeta from the Military Nursing Service, presently holding the appointment of Brig MNS Headquarters, Southwest Command, Jaipur. And in this appointment, I am currently overseeing operations across 10 hospitals. During my service as a part of in-service education, I have completed my graduation, my post-graduation, and doctorate, and many other certification courses in nursing. I have a deep academic background and good leadership experience, and I have tenated almost all the appointments in both nursing education, nursing administration. I am a recipient of the Vice Chief of the Army Staff Commendation for my dedicated service, member of Maharashtra University of Health Sciences, Nasik, PIMS Loni, KGMU, Atal Bihari Vajpayee Medical University, Lucknow. I have authored multiple publications in both national and international journals and actively contribute to academic research in military nursing. This module 4 is divided into 5 parts, and we have already finished with 2 parts, wherein part 1 we dealt with the overview of the health information system and its types, role, and architecture. In part 2, we dealt with hospital management information system, capabilities and functionalities, taking the example of e-Shushrut, and we have seen how hospital management information system benefits nurses. In part 3 of module 4, we will be dealing with electronic medical record or EMR, a case scenario, what are its capabilities, taking the example of Bamni, how does electronic medical record help nurses? And the second system which we will be dealing with is enterprise resource planning or ERP and the role of nurses using ERP. Electronic medical record. From the name itself, it says that the medical record or the patient information is in a digital format. We shall dwell into the details of what an electronic medical record is, which will help us track patient progress and support clinical decisions. Before we dwell into electronic medical records, let us consider a real-world challenge. Due to missing information, illegible handwriting, or delayed communication, lots of medical errors takes place in the hospital setting. Yes. What if every detail of patient's care was updated instantly and seen by everyone involved, from the nurse to a specialist? Definitely, it will be of great help to all of us in the healthcare industry. That is the reason we have electronic medical record. Electronic medical records are systems designed to capture, store, and manage patient health information in digital format. This is the definition of electronic medical record. This electronic medical record offers wide range of clinical capabilities, which helps the nurses enhance patient care, support clinical decision making, and improve overall healthcare delivery. Electronic health record and electronic medical record. When we look at electronic health record and electronic medical records, it is important to understand how they differ. In the concept, Electronic health record is a digital record of a patient's health information accessible across healthcare settings. Whereas electronic medical record is a digital record of patient's medical information within a specific healthcare organization or area of practice. What are the benefits of electronic health records? Electronic health records facilitate comprehensive and coordinated care, support clinical decision making across healthcare settings, whereas electronic medical records improves documentation and care management within specific healthcare settings. Everything comes up with a challenge. What are the challenges with electronic health record? Electronic health record needs operability, interoperability, and data exchange across healthcare settings. Whereas the challenge with electronic medical record is it also requires interoperability and data sharing within the specific healthcare organization. Compliance need in terms of electronic health record, it is adherence to interoperability standards and data privacy regulation across healthcare settings. Whereas in electronic medical record, the compliance need is with privacy and security regulation for patient data within specific healthcare organization. Looking at a case scenario using electronic medical record, we have Mr. Ravi Kumar, a 58-year-old male who arrives at the hospital for a routine checkup. The nurses then use the electronic medical record system to access his previous health records, update any new findings, and carry out related clinical tasks. This includes reviewing past medical records, that is the first step. Then the OPD nursing assessment, the second step. Administration of medication as and when required. Referral for lab test. Referral to the medical or the surgical specialist or the physician. And last step is follow-up. Now, in the further slides, we will look into and see how electronic medical record is used to carry out all these daily activities. Taking this case scenario of Mr. Ravi, let's explore how electronic medical record is being used in routine clinical practice. At the registration desk, as the receptionist enters Mr. Ravi Kumar's unique health ID, instantly pulls up his previous health records from the EMR section. This saves time and ensures continuity of care. The second step, OPD nursing assessment, in which we have the profile of Mr. Ravi, where we review his medical history. And during this, the nurse does the assessment and updates the data, that is his current weight, temperature, blood pressure, and blood sugar level directly into the system. This updation of information is instantly visible to the doctor, enabling better informed decisions during consultation and helps us in patient care. The third step, after the checkup from the doctor, if the doctor prescribes medication and orders blood tests, the nurse reviews these orders directly in the electronic medical records, administers medication as and when required, and updates all related details in the system. Lab requests are also sent electronically via electronic medical record, helping reduce delays and prevent manual errors. Once the lab results are available, they automatically appear in the electronic medical record, and the nurse has to only review the clinical parameters, closely monitors the patient's condition, and informs the physician if anything is concerning, if any results exceeds warning limits. The electronic medical record triggers alarm, ensuring timely response and intervention. Later, if Mr. Ravi is referred to a specialist, the referral details, along with his relevant medical records, are seamlessly transferred through the electronic medical record to the specialist, ensuring continuity of care. The sixth step, that is the last step, follow up. The nurse schedules Ravi's next visit using the electronic medical record. She also counsels him on medication adherence or compliance and necessary lifestyle changes based on the doctor's recommendations. Additionally, the electronic medical records system sends automated reminders to Ravi, helping him keep track of his appointments. In short, these steps show how an electronic medical record system simplifies and streamlines the patient care area at every point of service delivery. Now, let us look into how electronic medical records help us in the clinical area. There are four capabilities of electronic medical records. The first being clinical patient record. This involves complete management of both inpatient and outpatient clinical data. That means there is comprehensive data of the patient which is available while he attends the healthcare setting, both as an outpatient or an inpatient. This data will help in clinical decision making. And as and when required, it gives out reminders and alerts, and care pathways are mentioned in the electronic medical records. The third is care management, which offers ready-to-use documentation templates, supports medication handling, and enables smooth change of patient information. And finally, clinical analytics, the fourth capability. This supports clinical reporting and tracks key performance indicators or metrics to identify trends and improve care outcomes. Together, all these four clinical capabilities make electronic medical records not just record keeping tools, but powerful platforms for decision making, care, coordination, and performance improvement. Is an example of an electronic medical record platform, which is an open source healthcare software developed by a group of organizations, including ThoughtWorks, Partners in Health, and the Open MRS community, or the Medical Record System, Open Medical Record System community. It is designed to meet the needs of the hospitals, clinics, and rural health centers by offering a comprehensive and integrated digital solution. Bamni combines both electronic medical record and hospital management information system capabilities and is fully compliant with Ayushman Bharat Digital Mission, or ABDM in short. It is built on the Open MRS, that is Medical Record System, and is widely used in low-resource healthcare settings to manage electronic medical records. Using Bamni as an example, let us further explore the capabilities and functionalities of electronic medical record. Moving ahead, we will explore how electronic medical records help in maintaining accurate and comprehensive clinical records. Outpatient records capture consultation details, treatment plans, and visit notes electronically, improving continuity of care during outpatient department visits. Whereas inpatient records allows for seamless documentation of hospital stays, including admissions, diagnosis, medications, and nurses' notes. For instance, nurses can update vitals, record the medications which they have administered, and observe directly into the electronic medical record, ensuring real-time information sharing with the healthcare team. The second capability, that is clinical decision support. Let's understand how clinical decision support helps improve patient care. These systems generate reminders and alerts to guide nurses and other healthcare providers. For example, prompting timely interventions or warning potential risks. These are the alerts which are being given by the electronic medical records. They are also predefined care pathways that assist in managing specific medical conditions or procedures. For instance, if a patient's oxygen saturation is falling below 90%, the electronic medical record system sends an alert. And as nurses, we need to know that his oxygen saturation is falling, hence, give him oxygen therapy and inform the physician. This is how it helps in clinical decision making. The third capability, that is care management. EMRs support care management by offering standardized documentation templates that make charting more efficient and consistent. They also enable accurate tracking of medication lists, prescriptions, and administration records. So, in practice, a nurse, if she records the vital signs and the intake output details directly into the electronic medical record, maintains structured and timely updates, that helps and support continuity of care. The fourth capability is clinical analytics. Electronic medical records also provide valuable clinical analytics and capabilities. Using the key performance indicators or matrices and measurable metrics, healthcare teams can track and evaluate the quality of care, such as how promptly medication is administered or how frequently or how often infections occur in an individual. This helps identify patterns and opportunities for improvement. The clinical data in the electronic medical records can also be analyzed to guide research and enhance decision making based on the real world outcomes. For example, a nurse uses electronic medical record to monitor key performance indicators like timely medication administration, ensuring each patient receives drugs within the prescribed window, or using patient safety standards. To begin with, electronic medical records provide quick and efficient access to patient records, lab results, and medical history, enabling timely and informed care delivery. They enhance patient safety through standardized documentation and medication alerts, which help prevent errors. It also helps the nurses manage medication more effectively by tracking dosages and interactions. Electronic medical records saves time by streamlining the documentation processes, reducing the burden of paperwork. Most importantly, they support better coordination and communication among healthcare providers, promoting holistic and well-organized patient care. Let us check how much we have understood electronic medical record. The question is in front of you. Now, let us look at the concept of enterprise resource planning or ERP in the healthcare context. Enterprise resource planning integrates hospital operations like human resource, inventory, and finance, helping nurses work more efficiently within a larger hospital ecosystem. We have just now understood hospital management information system and electronic medical record, how it works inside the hospitals. But hospitals is more than patients. We have human resource, finance, logistics, and inventory. So, what kind of system do you think could connect all these departments like pieces of a puzzle? Yes, it is enterprise resource planning. This is the second system which we are going to discuss. Enterprise resource planning is a type of software that helps organization manage and integrate their day-to-day operations all in one place. It is especially useful because it keeps everything centralized. It reduces manual work and minimizes errors. It enhances communication across departments and saves time and boosts overall efficiency. An example for enterprise resource planning is ERP Next, which is again an open source ERP software. So let us remember ERP Next as a software for enterprise resource planning. ERP Next is an open source enterprise resource planning solution. It is comprehensive. It is designed to streamline healthcare business operations. It is built on FRAP framework, offering customization opinions. While eAushadhi, another example of enterprise resource planning, it is not a full ERP solution. It is a strong example of ERP module which focuses on drug inventory and pharmacy management. It is developed by CDAC. It is used in public health systems to manage medicines, stocks, and distribution efficiently. All of us working in hospital must have handled this software, eAushadhi. It is presently available in almost all the hospitals where we are working. Let's see how enterprise resource planning system helps change in the role of a nurse. While ERP systems are mostly used for administrative and resource management in healthcare, we nurses play a supporting role by interacting with the ERP modules. First is inventory and supply chain management, where we nurses use ERP to request and track essential items like medications and medical supplies, ensuring nothing critical is missing during patient care. Very important, it helps in inventory and supply management. Patient, when we want for leave and organize shift timings, all digitally through the ERP portal. Finally, human resource and payroll access allows nurses to view attendance, download their salary slips, and review performance related updates, helping them stay informed and organized. The other two roles are billing support, that is, we nurses can record services or medications which we administer to patients into the patient billing module. ERP systems also help us coordinate with departments like lab, pharmacy, and radiology. Indirectly, there is workflow coordination. ERP system also contribute important data that is used in the hospitals, reporting and audits, which help we nurses in rendering quality patient care using patient safety. We have dealt with enterprise resource planning and the role of a nurse using this enterprise resource planning software. Now let us check how much we have understood what is the role of a nurse in enterprise resource planning. The question is flashed on this slide. That brings us to the end of Module 4, Part 3. In this part, we explored electronic medical records, EMRs, through real-world examples like Bamni, and discussed how electronic medical records benefit nurses. We also looked at the basics of enterprise resource planning, ERP, as a system software, and how they support hospital operations. Coming up next, we will explore how telemedicine and telenursing enable remote care delivery, what is the role of remote patient monitoring, and how personal health apps and devices are transforming disease management. Thank you all for joining this session, and we hope this helped you understand how digital systems like electronic medical record and enterprise resource planning are transforming nursing and healthcare delivery. Stay tuned for the next part as we dive deeper into telemedicine, remote monitoring, and digital health tools. Thank you.